to that extremity. There are 3 ways everyone can assist the stroke survivor to incorporate that hand into daily functional activities. First, you can have the patient in weight bearing over the hemi side using the hand as a stabilizer. Second, you can do guiding, where you place your hand over the patient's hand, taking them through normal patterns of movement. And third, bilaterally, having the patient use both hands together at the same time. Each time I work with my patient, I try to incorporate these 3 techniques into my treatment program. It can be as simple as helping them to hold or stabilize an object, such as when Harriet visits with Ruth, her next-door neighbor. Ruth not only knows to sit on Harriet's weak side, but she can also learn to assist Harriet's weak hand.
See him either. No, but that's his dad.
Can you pour yourself a glass of water, Harriet?
I don't know what they're...
Instead of doing everything for Harriet, I can help her to use that hand as a stabilizer. I include it even when she pours a glass of water. I have found that patients who are positioned in this way, with the arm supported and used as a stabilizer, are more likely to spontaneously include that extremity into everyday tasks. Guiding is another method which can be used to help improve function and awareness of the hemiplegic side. It is incredibly effective. When I guide the patient's weak hand, I place my hand over their hand and try to move with them in as normal a movement pattern as possible. I try to imagine it like this. If you were to erase me out of the picture, would the position of the patient's hand and arm still look pretty normal?
Not bad.
Do you think we can reach with this hand? I use this method a lot with non-functional upper extremities. The benefits can be tremendous. With my assistance, the patient receives normal sensory information along with normal patterns of movement during functional tasks. Should we try with this hand?
Yeah.
Okay. When I guide their hand toward the weak side, it helps patients turn their head past midline. Those with a visual field deficit learn more quickly how to compensate, as their eyes almost always follow their hand. This is easy to do and takes only a few seconds. Well, you know what? Let's try using this hand. When locking the wheelchair brake, instead of always using the strong side, sometimes I try to incorporate their weak side. That's great. Let's try and see if we can use this hand a little bit. When doing self-care skills in the morning, I take a moment to include the involved side. Harriet could wash her face with her right hand, but why not include the left hand also?
You know, let's just try and see if we can use both hands on that.
Or during a meal. When appropriate, I include the involved hand.
And let's just see. You can take this, and we're going to see if we can use both hands to help here. That's it. And just don't bite your fingers. Try that again.
I look at the whole person.
Let's get your foot flat on the floor. Instead of being on that footrest. And then watch your arm and let's put it up here on the table.
When Dale comes to the table for lunch, I help him to have a good base of support by taking his foot off the footrest and placing both feet flat on the floor. This also helps him get more equal weight bearing through both lower extremities.
Put it over here.
I help him to place his hand up on the table.
Let me just help you here.
In your setting, try to have each patient sit with both feet on the floor, arms positioned on the table during all of their meals. They'll do much better. As soon as possible, I also like to help the patients learn to take care of that side. By teaching Harriet to clasp her hands together, she will begin to remember it and not leave it behind. As she rolls over in bed, she keeps her hands together, helping her to roll toward her weak side without rolling onto her shoulder, which could cause a possible impingement at the glenohumeral joint.
Good. Isn't it when you try?
In the case of Dale, it can help him learn to inhibit his own abnormal patterns of movement. By clasping his hands together to take his foot on and off the footrest, he brings his scapula forward, helping to reduce flexor tone of the upper extremity. At the same time, he learns to incorporate that hand into the task. Each and every opportunity, large or small, can help the overall recovery of this patient.
Well, here.
Another possibility for helping to improve function and awareness of the hemiplegic side is to have the patient do part of the task bilaterally. In other words, with both hands together at the same time. Dale has always shaved using his strong hand. He can do it well and he can do it independently. For me to insist that he always uses both hands to shave would be inappropriate. However, if I can have him include the weak hand at some point, even for just a portion of the activity, it will benefit him in many ways.